When folks ask about, do you know Tyler McLeod? Is that kid that races? That's me.
He started racing as soon as he got old enough in the very rookie classes and stuff, and just loved it that much and just stayed with it.
You didn't have to worry about him much. He was a normal boy, spent 90% of his time at the go-kart track.
Tyler's just outgoing, friendly, never meets a stranger.
Tyler's a great guy, something else. I met Tyler when I was 7 years old, and we've been best friends ever since.
Oh, come on!
Told him that I may need some help down in South Florida. I got on with a pretty decent job, you know, doing insurance adjusting.
Our last trip that we were down there, we were coming back home, and we hit the causeway and seen them lights in Mobile.
Mobile County EMS and Fire, what is the address of your emergency?
I just had a car hit me at a high rate of speed. His car is pretty tore up, and I would presume he's hurt.
When we got there, the left side of the car, the driver's side of the vehicle, had significant damage to it, and the front of the vehicle had significant damage to it. He was in the driver's seat and looked to be unconscious when we first pulled up. Pritchard Fire Department had to extricate him out of the driver's side. The door wouldn't open on its own. The right side of his head was very bloody, large laceration, looked to be a possible skull fracture involved. And we knew we had to get him out of there and get him out of there quick.
And my phone rings, and it was a friend of mine. She said, have you talked to Tyler? I was like, yeah, I just left him an hour and a half ago. She's like, no, like within, the last few minutes. I said, no. And she said, well, some guy just called my phone and said that he had been in an accident.
When we got him into the back of the ambulance, we realized he was even worse off than what we initially thought. We had more lighting, we could actually see him. We evaluated him from head to toe to make sure we wasn't missing any injuries, but everything seemed to be in the bulk of his problem was going to be his head.
So I called his phone, calling his phone, nobody's answering. I called Jake, couldn't get in touch with him, so I called his dad.
So I said, you know what, I'm gonna get in my truck and I'm just gonna go ahead and drive the highway.
Before we left the scene, we made sure we knew what was going on with him. We went ahead and got 2 large bore IVs in him. We got him on oxygen to help maintain his airway and make sure he was perfusing properly, and to try to replace some of the blood he was losing because he was bleeding pretty heavily from his head at that point. And it looked like a large scalp laceration with what appeared to be a skull fracture. So we put a bulky dressing over the top of it to kind of tamponade off the bleeding and try to keep him stable and route to the hospital and try to replace some of the fluids he was losing at that point.
By the time I had driven all the way back onto that main highway of I-110, I seen the lights as soon as I rounded that corner. I says, where did they take him? He said, the USA Hospital.
At that time, I thought it was really kind of touch and go, because with head injuries, it can go one way or the other, and it can go that way very quickly. So that's why we made sure we had double lines in place and everything. We wanted to be prepared for any eventuality and to make the transfer once we got to the hospital as seamless as possible. It wasn't very long. The transport time was pretty short because the distance was probably less than 4 miles from where we were at to the hospital.
A Level 1 Trauma Center is basically a hub for a community of individuals that are focusing on trauma. This is not our side job. It's not what we do after we finish our elective case and then we start taking care of trauma. It's what we focus on. It's the doctors, it's the nurses, it's the therapists, it's nutrition, it's social services. It's just a huge team effort. And to make that kind of team work, you need a Level 1 trauma facility for them to be in.
Whenever we have a major trauma, we get notified via what we call a trauma alert, It's when they notify and activate a wide variety of interdisciplinary specialties that there is a major trauma with an acutely injured patient coming, and we are able to mobilize the physicians, the nurses from the SICU, our surgical ICU, and respiratory therapist, anesthesiologist, and our ER physician. So we mobilize a large group of interdisciplinary team to come and evaluate the patient and be ready for when the patient arrives. The first thing that I recognized with Tyler is that he needed to have a breathing tube to help support his breathing. We checked on his vital signs and blood pressure, and noting the large amount of blood that he had lost from his significant facial lacerations and scalp lacerations and skull fractures, we knew that we had to provide emergency blood and blood products to him.
He received a chest x-ray. We did a CAT scan of his head, neck, chest, abdomen, pelvis, looking for other injuries. After we reviewed those films and didn't see any indication that he needed to go to the operating room for anything not related to his head, we took him up to the surgical trauma intensive care unit.
When he came in, he was neurologically in a coma, not doing anything for us, not following any kind of commands.
With the amounts of traumatic brain injury that he had in his facial fractures and the rest of his trauma just to his body, he was in rough shape. What I remember most from him is like how frequently his parents and family were there at all times.
Tyler had already been put into the ICU on the 8th floor. When I turned that corner and looked into that room, I didn't even really recognize what I was looking at.
You couldn't tell who it was, period. He still had the neck brace on. The blood was everywhere. His face was so swollen.
It was just something you never think you'll see.
Rusniak had come in and pretty much, just told us that we needed to call everybody in, that if he made it 72 hours, it'd be a miracle.
The day that the wreck happened, I was able to go back there and see him, and it was hard because I couldn't tell if it was him or not. It was very difficult on me. And, I couldn't believe it. The thought of him not making it never really crossed my mind. I couldn't see myself going on without somebody that I've grown up with and been around my whole life. I just tried to stay as positive as I could.
The first things we do with a head injury is we worry about swelling inside of the skull itself. If the pressure builds up too high inside of the skull, it actually tries to herniate or push the brain out of the skull. And so we monitor various factors of the patient, and we just wanted to make sure that he wasn't going to get worse before he got better. Most of the time, surgery is needed in the first 12, 24 hours, but in his case, it was actually over a week later that he ended up needing brain surgery.
For these patients that have traumatic brain injuries and severe swelling of the brain, our colleagues, the neurosurgeons, go in and remove a portion of the skull to allow the brain to expand. Typically, they do not place the skull back. They save it and just close the skin, so that allows basically everything to expand. So for a temporary time, a portion of the skull is missing.
He's in a coma for 3.5 weeks. I would just sit there and just hold his hand, and I don't know, I knew it would be okay. I knew he would be fine. I didn't know when, but I knew he would.
I stayed in that hospital until the day he woke up, every night. I'm just constantly speaking, talking to him. We brought a lot of his trophies in. I want to make sure that he knew that his family was there and that we loved him, and don't be afraid, and many prayers by that bedside.
By this time, we would kind of, leave for a few hours, go home. Me and his dad would swap or whatever. And it was my turn, and they closed the ICU off from 6 to 8 in the morning and 6 to 8 at night. And I'm sitting there just waiting. His dad was on his way. And the nurse comes out maybe 30 minutes later. She comes out and she says, he's awake.
The very day that my eyes opened up, I stood up on the side of my bed.
So I'm still in shock. So I go up, I talked to his physical therapist. She said, yes. She said, I went in, he woke up. She said, I sat him up on the edge of the bed where he's sitting there. And she said, I asked him, did he want to stand up? And he said no, but then he just stood up.
Tyler's mother called me, Julie, and she said, I got some good news for you. I said, what's that? She said, Tyler's awake. I said, are you kidding me? She said, he is sitting in a chair. I said, you do what? She said, they have him sitting up in a chair. It was tear-bound joy right then. I'm like, thank you, God,
I got a text from his mom that said he was conscious, and I rushed to the hospital. That's when I knew, we're getting there.
I couldn't walk. I'd lean to the side. All my balance was shot. I had to regain all of my balance, my motor skills.
As far as progressing, he did so great with physical therapy. We were using a slide board, putting him over in a chair, had him sitting up, and he did great with that. Worked with occupational therapy, really, working on getting that strength back in all of his muscles, and he did amazing with that.
I gained everything back really, really fast. Nine months after that, we went in with the second attempt. Same thing. That thin spot on my head started easing back open. Well, it started out as a pinhole. We were going to try to fix the hole. The hole got bigger. It didn't work. They had to take it back out again. Here I am. Here I am.
I have never in my life seen people that just, even to this day, me and him can go to the hospital and they remember who we are. The lady, I think her name's Miss Anita, in the waiting room. She's become part of our family.
And when I say he was willing to go the extra mile to do what he had to do to get better, he did that. And his parents stuck by him. They really did. Everybody, grandmother, mom, dad, everybody. They did a good job. He's real loved. He's loved. And I love him too.
I think it's just amazing to see someone so critically ill when they first come in that they are moments away from death, and to just slowly turn that around. But it's tribute to his family and to like the EMS and my colleagues and the nurses who received him in the trauma bay and basically stabilized him to being in the ICU for a long time and eventually going to rehab. It's a lot of people, but it's still pretty incredible.
If I had any message to tell anybody, never give up. No matter what life may throw at you, no matter how hard times may seem, no matter how much struggle you're going through, there's always a brighter side and you can always dig through it.
I used to be that guy that thought that those kind of things only happened to other people, and now that it has struck us, this accident has changed me and many others too. In the racing, it's going to take a little time, but he'll be back.
If anybody was to question me about where to go or where they should send somebody, USA would be the only suggestion I would have.
There's no words ever that I could put together to thank them. There's nothing I could ever do that could thank them, period. I mean, I can say thank you 100,000 times, but that's nowhere near how I feel for them.